Measles is always a public health concern. The chances of measles occurring in South Carolina has increased due to falling vaccination rates here and more cases occurring across the United States. As long as measles circulates anywhere, people in our state are at risk. As people travel, anyone who has measles can spread it to other people, especially people who are not vaccinated or people who have not previously had the measles. Measles is caused by a virus that infected people can spread to others by coughing and sneezing. It's one of the most contagious diseases we know. In fact, once a person with measles leaves an enclosed room, the virus can remain in the room for up to 2 hours after they leave. The symptoms of measles starts with a runny nose, red eyes, and a fever. After that, a red rash appears that usually starts on the face and then spreads to the rest of the body. Measles can be complicated by infections of the respiratory system and the nervous system, and can result in hospitalizations and can cause long-term effects and even death. People should be aware of who is vulnerable to measles. There are some who are more likely to get measles infection, and then there are those who are more likely to get sicker from measles if they get infected. Those at risk of getting the disease includes anyone who does not have protective immunity that comes from either being fully vaccinated or from previously having measles. Measles is so contagious that 9 out of 10 people who are not immune will develop measles if they're exposed. People who are at higher risk of complications from measles include children younger than 5 years of age and adults over the age of 20. Also, anyone with a weakened immune system and pregnant women are more likely to have complications from measles. The best way to protect yourself from measles is with vaccination. Vaccination is very effective. Over 97% of people who have received 2 doses of the vaccine will have lifelong protection against measles infection. To prevent measles in South Carolina, DPH conducts a number of activities. DPH also monitors the occurrence of measles in other parts of the country and around the world to help us prepare. We keep close watch for cases in South Carolina. DPH encourages healthcare providers to be on the alert for measles and report any illnesses they suspect might be measles. DPH investigates all reported cases of rash illnesses with a fever to identify possible measles cases quickly to prevent spread. If you or a family member become ill with a rash with fever, call a healthcare provider about your symptoms first to see if measles testing is recommended. Alerting the healthcare provider before visiting a clinic will prevent spread to others if measles is the cause of illness. Measles vaccination is safe, effective, and strongly recommended to protect everyone against measles. This also protects those who cannot be vaccinated because they are too young or have certain medical conditions. Measles vaccines are available in DPH clinics. Check our website at dph.sc.gov for information about vaccine appointments. Vaccines are also available in doctor's offices, community health clinics, and many pharmacies. DPH encourages everyone to talk with a healthcare provider to make sure they are up to date with recommended vaccinations. Together, we can limit any impact measles might have in our state.